the kidney.
All right, so let's get right into it. A lot of us have heard of or even had a urinary tract infection, a UTI, right? But that's just where our story kicks off. The real question, the one we're digging into, is what happens when that problem, well, doesn't stay put? What happens when those bacteria decide to start climbing?
So this upward journey actually has a medical name, and it's a big deal. It signals that the infection has reached a whole new critical stage. This is where our intruder, the bacteria, finally arrives at its destination.
Okay, so the condition is called pyelonephritis. I know, it's a mouthful, but let's break it down. It's basically an inflammation of two super important parts of the kidney. First, you've got the renal parenchyma. That's the real workhorse tissue, the stuff with millions of tiny filters that clean your blood. And second, there's the renal pelvis. Think of it like a funnel that collects all the urine before it heads down to the bladder. So what we're talking about here is an attack on the kidney's core machinery.
So who is this intruder? Who's the bad guy in our story? Well, in most cases, the main culprit is a bacteria you've definitely heard of, E. coli. Yep, that E. coli. Now, it's often totally harmless in our gut where it belongs, but when it gets into the urinary tract and starts climbing, that's when it becomes a really serious threat. So how in the world does this invasion even happen? I mean, the bacteria don't just magically teleport into the kidneys, right? They have to take on this really tough journey, literally swimming against the current of the urinary system. Let's trace their path.
It really breaks down into a three-step process. Step 1 is entry. This is where the E. coli gets into the lower urinary tract in the first place. Then comes migration. And this is the key part, the big ascent, where the bacteria travel up from the bladder, heading for the kidneys. And finally, if they make it, they colonize the kidney tissue. And that's it. That's the infection we call pyelonephritis.
But here's what's really interesting. The bacteria don't always do it alone. They often get help from a couple of accomplices, you could say. First up is a urinary obstruction. Think of a kidney stone, maybe. It blocks the flow of urine, creating these stagnant pools, which are just a perfect breeding ground for bacteria. And then there's something called reflux. This is a condition where urine actually flows backward, from the bladder up towards the kidneys. It's like giving the bacteria an escalator, a free ride right up to their target.
Okay, so once the bacteria have set up camp in the kidney, the battle is on. And this fight can go down in two very different ways. It can be a sudden, really intense fight. That's an acute infection. Or it can turn into a long, drawn-out war. And that's what we call a chronic infection.
And this slide just illustrates the difference so perfectly. If you could actually see the kidney with your own eyes, an acute infection would look like a swollen, angry, inflamed organ. You'd probably see these yellowish abscesses, which are basically little pockets of pus. But a chronic infection? That tells a totally different story. The kidney is often shrunken, withered, and covered in deep, permanent scars from that long, drawn-out battle.
Now let's zoom in even further, down to the microscopic level. With an acute infection, the tissue is just flooded with the body's first responders, these immune cells called neutrophils, rushing to the scene. But in the chronic cases, the battlefield looks completely different. You see widespread fibrosis. That means tough, useless scar tissue is replacing the soft, functional kidney tissue. And you also see tubular atrophy, where the kidney's tiny, delicate filtering tubes are literally wasting away. We're talking permanent damage here.
Of course, a battle this intense raging inside your body, it's not going to happen silently. Your body has a very effective alarm system to let you know that something is seriously, seriously wrong.
Yeah, and we're not talking about subtle hints here. When your kidneys are under attack like this, they send out clear, unmistakable distress signals that you just can't ignore. Recognizing these signs is absolutely crucial. You've got a high fever, that's the body's classic response to a major infection. Then there's severe pain in your side or back, right where the kidneys are. That's a huge giveaway. You'll probably also see urinary symptoms, cloudy or maybe even bloody urine. And because the kidneys are struggling to do their job filtering waste, all those toxins can start to build up, which can lead to nausea and vomiting. It's a full body response.
So what happens after the fight is over? I mean, the body can win the immediate battle against the bacteria, but the war itself can leave behind permanent scars on the landscape of the organ.
And honestly, this is the most important takeaway of the whole thing. An acute infection, if you catch it and treat it, can resolve. But a chronic or recurring infection, that's not just a temporary problem. It physically remodels the kidney. It leaves behind scar tissue that can reduce its function forever. And that is so critical
because reduced kidney function can lead to all sorts of long-term problems, like high blood pressure, and in the worst cases, even kidney failure. The invasion leaves a lasting, dangerous mark.
So where does that leave us? Knowing that an infection that can start out feeling small or minor can travel and escalate and cause irreversible damage, how does that change the way we think about it? It's a powerful reminder, right? That maybe no infection is truly minor when it has the potential to do something like this. And it really drives home how important it is to listen to our body's alarm bells.